Hello, everyone, and welcome to another episode of Squad Academy. Today, we have a very special, I'll probably say unique, in the sense that this is the first time we're having someone within that space coming today. And I feel like it is. I feel like we've been talking a lot about this sector this year, but we have someone
Yeah.
from we have someone from the healthcare space today. Temitope Coker, who is the founder of TCHealth. TCHealth was founded in 2021, and they're a platform that provides healthcare and pharmaceutical insights in Nigeria and sub-Saharan Africa for healthcare enthusiasts through analytical thought pieces. Temitope, thank you so much for being here with us today. How are you?
Hi, I'm actually really excited to have this conversation. So thank you so much for having me. I feel like I always, even in social context, I'm always trying to like get into a healthcare focused discussion, and then obviously people start rolling their eyes. So the fact that we're talking healthcare for the next, I don't know, like hour is really exciting for me. I think you hit the nail on the head with TC Health. I just want to briefly introduce myself more broadly. So I work in strategic advisory. I have been for the last 5 years, specifically pharmaceutical and life science advisory. I specialize in value access and pricing in terms of helping our clients in the biotech industry, in the pharma industry, come up with launch strategies, commercialization strategies that enable them to get access in the market and enable them to sustainably price their drugs for access. And so, through that, I've played a major role in kind of advising these global biotech and pharma companies to kind of optimize their products across a number of disease areas and international markets. And one of the reasons why I founded TC Health was just because I was writing so much content for my company about the global life science space. I felt like there was so much innovation happening. You have all these new types of therapies, potentially curative therapies for cancers and diseases that we just kind of felt, you know, there was no hope. There's a lot of, interesting innovations that are going on. And I felt like there was a void of that type of content in the African context. So that's kind of why I started TC Health. It's started small and we've grown since, and we now have a team, and we've started a collaboration business where health tech startups and companies collaborate with us and partner with us to raise awareness of, create content to raise awareness of the kind of subsector within healthcare that they are operating in. So I'm really excited to talk about all things healthcare today.
Awesome. Awesome. Thanks for that kind introduction. Just real quick, one thing that stood out to me was that I think you're an economist, like back as far as background, educational
Yeah,
background.
so I studied economics at Columbia University. Yeah.
Okay, so how's it was it just career that sparked the niche focus on healthcare, or how did that go?
So I have a lot of doctors in my family. There are lots of doctors on my dad's side of the family. And so I was exposed to healthcare really early. And I would spend summers, shadowing my aunts and uncles in their different in their different hospitals and clinics. But so I kind of already had it in my mind that I wanted to be a doctor when I was really, really young. I was very good at science, very good at math, and I was just on that path to wanting to become a doctor. But I think there was a summer that I spent shadowing in Lagos, and I was kind of working with the founders of this clinic. And so, in addition to like the clinical side of things, I was also shadowing them when they're discussing some of the resources, discussing the business side of running a healthcare facility in Nigeria. And I just was exposed to how unnecessarily difficult things are, how unnecessarily challenging it is to provide quality care for people. And you kind of see that juxtaposed with doctors and physicians that are actually really passionate, that are actually at the top of their game. They're like very enthusiastic about providing quality care. And so that kind of got me thinking about maybe it would be better to get involved in the business side of healthcare and try and make an impact on a broader level. So when I got to university, I was on the pre-med track, and then I kind of changed my mind, and economics was the easiest major to just take, just because I did all the like calculus, all the pre-calculus, all of those prereqs that you needed for economics. And I found it really interesting because I was always applying everything I was learning to, okay, how is this relevant to healthcare? So yeah, that's kind of how it came about. And then obviously I started working in life science consulting, which is the perfect blend of science and healthcare and business and economics.
Yeah, thanks for providing that color. Thanks for providing that color. So you kind of talked about what the health care space was like in Nigeria and Sub-Saharan Africa, which is what inspired you to take that leap, right?
Mm-hmm.
So the one thing that we've kind of seen over the past couple of years, and the World Health Organization also kind of did a report on this, and I want to get your own thoughts on this, right? So the World Health Organization published a report on how I think it was about 49 countries now have below, or sorry, about 55 countries now have below 49 healthcare workers per 10,000 people or so. And it kind of just shows how a lot of healthcare professionals are leaving their countries for greener pastures. And I believe about 37 of those countries are African countries. So what's I just want to get your take on that, because you're an expert in this field. Like, what's your take on that? What do you think we should be doing to really curb some of these issues and problems?
Yeah, no, honestly, the topic of brain drain within the healthcare industry, especially in sub-Saharan Africa, is such an important topic to have, because there's no healthcare company or any healthcare venture that's operating in that space that isn't going to be impacted by brain drain. And we actually wrote an article on brain drain in Nigeria at TCHealth. It was one of our first few articles. And the main takeaways were that in Nigeria, and I think it also applies more broadly, doctors and nurses are just overworked, they're underpaid, and they're underfunded. So I think that's pretty much in line with the WHO report. There's only one doctor, nurse, or midwife per 1,000 people in Nigeria, unlike where you see countries like the US and the UK, they have 17 and 11 respectively. There's just not enough doctors to go around. And Nigeria's population is breaching 218 million. I believe it's probably higher than that. We'll see when the latest census is actually conducted, but we're a massive population and we don't have enough doctors. And the doctors that we do have are so burdened with the amount of patient load that they have that it's like severely impacting their quality of life and the quality of service that they're able to provide. And then you also think about the fact that they're underpaid. So their salaries are very low. I think we did some, salary analysis, and some consultants that have on average about 10 years of experience are making between 8 to 15 million naira per year, which is basically a salary of $40,000 in the US. And the government isn't spending enough money on healthcare. I think the latest stats were only about 4% of our GDP on healthcare expenditure. Again, you look at other countries like the US, the UK, etc., they spend well over 10% of their GDP on healthcare. So, this is why our doctors and nurses are leaving at these astronomical rates. Like, the numbers are actually, they are striking. So like over 2,000 doctors have left Nigeria over the last few years. And surveys have said that about 9 in 10 are considering leaving the country. Like, they're already making plans, trying to take the relevant exams to leave the country. And this is spanning across all specialties. So right now, there's only one cardiologist for every 10,000 people in Nigeria. There are only 75 registered cardiac surgeons in the country. 12 of them have actually left the country to search for better opportunities. So the number is probably even lower. There are only 200 psychiatrists for over 200 million people in Nigeria. And even the president of the Association of Psychiatrists in Nigeria said up to 2/3 of those have left, like they leave the country on an annual basis. So it spans all sectors, it spans all specialties. Doctors, nurses, midwives, they are all flocking out of the country. And so there's no sector in healthcare that isn't affected by this. And I think there are a number of ways to address this. I do think there should be policies that are aiming to address the issue. I just feel like the way that we approach these policies should be incentivizing and providing the right infrastructure and providing the right resources for it to be an attractive career path or profession for the people that are trained. And I think it also goes back to, it's actually an economic problem because we're spending a lot of money to train doctors, and it's Western countries that are reaping the benefits of the investment that African governments are making into their own, trainee doctors, trainee nurses. And a lot of this is also subsidized. So it's actually an economic problem. And I know we're going to discuss this new policy that is essentially making it so that you have to stay 5 years before you actually get your certificates. So it's basically blocking people from leaving. And there are two sides to this. You can block people from leaving, but honestly, Nigerians are very resourceful. People will find a way to leave one way or another. People will stay for 4 years, maybe get enough to qualify and then go out and, go to other countries. And so, yeah, I feel like it should be addressed by policies, but I think it's right. You have to have policies that are more holistic. So doctors should be incentivized to stay, nurses, midwives, all of them should be incentivized to stay, not forced to stay. And I mean, there are a number of ways you can go about this. There tax waivers, you can make it such that, some professions they have a specific tax rate, or they have a tax waiver. They have loans for housing with favorable rates. They have lifestyle stipends. There are a number of things that you can do to incentivize that as a profession to keep our doctors and our nurses and our midwives on the continent. Instead, that gives doctors something to look forward to. But again, that all comes back to, how does this get funded? If we're only spending 4% of the GDP on healthcare expenditure, how is this going to get paid for? You also know that Nigerian systems are prone to fraud and prone to, all sorts of things. So it also needs to be something that is fraud proof. So if you're giving a bunch of hospitals and universities certain funding, how do you know that that's going to go where it needs to go? What are the checks and balances? And then I also think there's a larger infrastructural discussion and change that needs to happen. I'm very interested in primary healthcare. So we don't really have a very well-developed primary healthcare space in Nigeria today. I think there was a recent report that showed that over 80% of our primary healthcare facilities are not really where they need to be in terms of quality. And I think if we have primary healthcare, we are able to reduce some of that burden on tertiary healthcare, on, secondary healthcare, and that will be able to kind of provide opportunities that allow some of the doctors, nurses, and midwives to spread the efforts and spread the patient burden. And that will require quite a lot of investment to kind of revamp our primary healthcare system and revamp the infrastructure that makes it so that, it's able to support the physicians and the healthcare professionals. And then just the last thing I'll say is, I think there's also an interesting part that the private sector can play in all of this. I think in order to make this an attractive profession, you also need to have a flourishing private economy and private business that's also driving that. So in America, obviously America has its own issues with healthcare, but in America, you see that a lot of, these hospitals are, getting funding for clinical trials and research, and they're getting, approached by lots of the pharmaceutical companies in terms of, at the cutting edge of new therapies, incentivizing use. Obviously, again, there should be checks and balances, but when you see that the healthcare system on a private sector level is flourishing, you tend to see that the doctors and the nurses and the midwives and all the healthcare professionals are also flourishing. So yeah, there's a lot of angles to this. I don't feel like one sweeping policy was exactly the right way to go about it. But yeah, that was my 2 cents. That was like a 5-minute ramble.
That was great.
That was more than 2 cents. That was like $5.
Yeah.
But thanks for that color, right? A quick question I have as a novice in the space, and someone who wants to get a better context. You talk a lot about the education aspects of it, right? And you even gave your own story about how you started with the pre-med track, and then switched back to economics. What's the academic track like? Maybe from maybe start from like senior secondary school, for someone who wants to be a healthcare worker? I know it's doctors, I know it's dentists, I know it's different fields, but like, what's the typical academic track like, typically locally in Nigeria? I want to have a better understanding of the pipeline.
Yeah, I'm not too overly familiar with it, but I do feel like it's similar to what happened in the UK. So after you finish secondary school equivalent,
Yeah.
as you're going to university, you can actually opt to go into medical school and you get your
Okay.
medical training. It ranges across different institutions, but it could be between 4 to 6 years of training. And then you kind of graduate from med school as a trainee or junior doctor. From there are a range of different foundational years and specialized training that you need to get. If, for instance, if you want to go into pediatrics, if you want to go into cardiology, you would then need to qualify and apply to then have a specialized training that then takes another number of years. Some of them can be 5 years, some of them go all the way up to 10 years in terms of the amount of training you would require to actually become a specialist in a specific aspect of the healthcare space. So it does take a lot of training.
Yeah.
There's a lot of training that goes into getting our doctors to be as qualified as they are. And despite all that training, and a lot of the teaching hospitals are doing great work. They have amazing professors like doing the most impactful work. And so you have to look at the healthcare space and really critically assess it to think, if people are getting this much training and this much high quality training, why are they leaving the country at these alarming rates? It's because it's not really a sustainable system as it is right now to support the doctors and nurses and midwives that we have.
Yeah. Interesting. I know that was pinching for questions as well, but another follow-up to that I'm curious about is that I think it's glaring to us. We see you mentioned the private sector has to, just like in the US, has to also take a bold step forward.
Mm,
We see that in the banking sector. Almost everybody that's studying maybe finance in university in Nigeria kind of already knows that there's a thriving and bubbling um, private sector, which is banks. Not everybody running to the CBN, Ministry of Finance.
mm,
They're running to like private banks who are sort of paying more than even the public sector. And then now you even have fintech. This is the tech equivalent or the tech copycats of that private sector. So you now have
mm.
two very thriving opportunities. What do you think is the reason why the private sector hasn't woken up as much in the healthcare space, and maybe slightly talk on even maybe private tech, health tech as well?
Yeah, I think that one of the key things to differentiate healthcare from other industries, like for instance, I think the fintech space is a great example of the amount of potential there is in a place like Nigeria or even in sub-Saharan Africa. But healthcare is like a completely different beast just because, it's not about, getting the, odd person on the street to like invest in something or give, a certain amount of their income into something. There's like a completely different attitude towards actual like healthcare and health insurance. And one of the things in healthcare is that a lot of people go into poverty from just debilitating healthcare bills and medical bills that they just can't cope with. Like that's one of the key things that actually drives people into poverty. But then you also have on the flip side of the coin, this really interesting attitude towards health insurance in the country. So I was talking to one of the people on our team, her name is Nabila on TCHealth, and she started this foundation in Kano for, providing maternity care for women in Kano. And she was talking to a physician there, and apparently some people consider health insurance to be haram, just in terms of mixing cultural and religious beliefs with health insurance. Like something about it just goes against the culture, if that makes sense. And what the physician had to do in their program was basically change the name from health insurance to something completely different in the local language. And the way it worked is you go up to each house and you say, are you going to be able to give me maybe like 200 naira for the month so that in case your neighbor gets into an accident next month, we've collected enough money to be able to help them. And then maybe, God forbid, if it's you, we've also, that's what this pool of funds is doing. So you have this interesting mindset towards health insurance. And you have to get health insurance right to get the healthcare right, because the fact that over 70% of our healthcare expenditure is out of pocket is a really, really alarming stat. And it means that every health tech startup that comes into Nigeria or into Africa, sub-Saharan Africa, when they're thinking, oh, we're going to give primary care, we're going to offer these new amazing healthcare services, which is great, and pushing the envelope, you then have to think, who is going to pay for this? You can approach the private HMOs, but they're not covering enough of the vast opportunity of our 280 million population to really change as much as you would want to scale up. Like, how much you could scale up, but it's a huge barrier when healthcare is like health insurance is just standing in the way. So even the NHIS, that's the public funded health insurance scheme, mostly for civil servants. I believe that only covers about, I think it's like 4% of people in the country have access to the NHIS. And so you see, I think that's one of the key things that I'm always trying to understand in terms of when you see that you have a fintech and that has scaled so much, healthcare can scale, but it has to scale in a completely different way because the infrastructure has to change. Like, it's not something that you can run over an app. You actually need physicians to get to patients. You need equipment. You need all sorts of things. The capital requirements are huge. So I feel like that's one of the things that, is really driving the difficulty in scaling a private sector business in healthcare in Nigeria.
Yeah, this whole healthcare conversation it's very sensitive and touching, right? Because this is something that directly affects our lives, especially when you have people that have been impacted, people that are close to you who have been impacted by this deficit we have within this specific sector. But I'm just curious to know, based off your expertise and experience, are you familiar with the Pareto principle?
The what?
Pareto principle, the 80-20 rule. Okay, so pretty much just says, I mean, you get to solve 80% of your problems by tackling 20% of the issues. So pretty much just says, okay, you know what? If you address these main issues, then they will bring about the biggest outcome that you need on the other end. So I'm just curious more on the healthcare space. What's that 20% within the healthcare space that we can address that will solve 80% of the issues that we're facing?
Interesting. That's an interesting question. I feel like it's health insurance. I think we need to take more out of the GDP to fund healthcare, to be able to provide. I mean, there was the new NHI Act that came out last year that actually mandates universal healthcare coverage for all Nigerians. Okay. Now, how that's going to be operationalized, I'm yet to dig into, but I feel like if we're able to provide the funds that are needed to give the vast majority of Nigerians, even the most basic of primary healthcare coverage, I think that would actually unlock so much potential in the healthcare market. There's a lot that you can do. You can, you can come in with the most innovative health tech app. You can do all of those things. But if no one is going to pay for it, the entire demand side of your market is gone. So I think if I was to say right now what the 20% is, I would say it's that. And I would also say another key thing to unlocking the potential is the primary healthcare system. Because primary healthcare I think it's a really interesting concept just because of how much it unlocks. So if you build up, not only does a functioning primary healthcare system solve a lot of challenges, it also kind of shifts from having a reactive healthcare system to a healthcare system that's focused on preventive care. And when you think about our changing healthcare demographics, we're moving from communicable to non-communicable diseases. More people are getting cardiovascular disease. More people are overweight. We're not really as active physically as we used to be, as more people are shifting into office jobs. Yeah. So we are and we're living longer. So we are getting to a point where our population in the future is going to start aging. We're going to see more chronic illnesses. And you need a healthcare system that is prioritizing preventive care. And there's a lot of opportunity that comes with that shift from, non-communicable to communicable diseases. And so when you have a primary healthcare system that focuses on prevention, you're almost unlocking this kind of opportunity that I think a lot of people haven't really considered, the huge opportunities there. So one thing about it is it's a huge potential for healthcare real estate. Having private primary healthcare facilities, maybe you also have some kind of subsidized program that allows you to take on NHIS enrollees and patients. But there's a huge potential for real estate there. Because when you think about a primary healthcare facility, it's not a tertiary facility, it's not a secondary facility. You don't really need that much capital. You just need a place where the doctors and nurses can go. You have the basic healthcare equipment that is maintained, and you have space for consulting rooms, you have space for delivery, you have space for waiting rooms. That is a huge healthcare real estate opportunity that I just feel like no one has really tapped into. So that's one thing. But when you have this network of primary healthcare clinics, it also kind of helps to allows you to track patients and tracking patient data, tracking your patient journey. Because think about how the UK works. Everyone goes to their GP if anything happens to me, I go straight to my GP. My GP is the one who does my primary assessment. If they see that, okay, I have something, God forbid, but okay, I have something, they will refer me to a tertiary center, a specialist. The specialists run their tests, figure out what's wrong with me, give me my treatment. But then I go back to my GP for the management of my condition. And okay, if something else happens, then you go back to your GP. Your GP is basically the hub of all of your information. They know every medication you're on. They know all your referrals. They know who you've seen, what you've received, how you're doing on the treatment. They're monitoring your progress. And that is a huge wealth of data and tracking. And I feel like if we have that and we're able to see, okay, well, the average Nigerian patient will come to their GP and they have this sort of issue, and then you can actually see how patients move through the healthcare system. And that kind of data unlocks so many insights that you need to design your business model, to know who your customers are, know where you need to go, where you need to divert resources and things like that. And it also it almost flips our healthcare model as it is today. In Nigeria, nobody really goes for regular checkups they just pray that God keeps them in good health. And then if something happens, it's usually a big emergency, you go straight to a tertiary center. And so a lot of tertiary centers are doing the referring back to primary centers, like, hey, you've come in here, but you could actually go to a primary center. And so that would almost flip it. And then you have a system that works, and you have a system that is tracking patients. And you have the health insurance that's covering all of this at the primary healthcare level, preventative care that's preventing any significant cost burdens if someone then develops something that progresses very fast. So I feel like if I was to pick two, I know I picked one, but now I picked two, it would be health insurance and primary healthcare.
So I want to, thanks for providing that detailed answer, but I want to double click on the health insurance, right? So I want to get your thoughts on this. Are you more for socializing healthcare? Countries like, I think, Japan, Austria, Denmark, I think Czech Republic is another one. There's some countries who have in some way successfully socialized healthcare. So is that your approach to it, or are you more on the, yes, let's provide healthcare, but let it be more privatized? Like we have the US and we have other nations who have done that as well. So what's your approach towards that? And both angles have pros and cons. Both angles have how they might work in a country like Nigeria, especially where the GDP and the economic growth is not as thriving as other nations. So which angle do you think would be the more feasible option for Nigeria?
Especially with 47% unemployment rate as well. So I'm going to throw that out there.
Yeah. I do feel like every country should have, at least at the bare minimum, some package of universal coverage for all of its citizens. So yes, that sounds like socializing healthcare, but you also don't want to go too far that direction, especially with the size of our population, because then you get into a situation like today with the UK and the NHS, the waiting times, the not being able to pay their doctors as much as they need to be paid, the doctors are overworked, and this is a socialized healthcare system. And obviously, there have been discussions about privatizing the NHS, which I mean, I'm not sure whether I stand with entirely privatizing it. But I think for a country like Nigeria, the basic package of primary healthcare coverage should be provided for all of its citizens at the bare minimum. And then you have additional coverage on top of that the HMOs are providing. So if you want more specialized care, if you want, then you're able to get that in one way or another. And I think a good market for this is Germany. So Germany has a big pricing and reimbursement body. It's called the GBA and the GKV. What the GKV does is it's basically the governing body of a bunch of private insurance companies. So they set a price when a manufacturer brings a drug into the country or whatever it is. They set the price. They negotiate with the manufacturer for the country. And then each of the private health insurance companies that are under the umbrella of this big national GKV body have their own, they can run their health insurance plans how they want, but they have to follow that national price. Now, sometimes manufacturers might go directly to those private insurance companies and negotiate other rates, like maybe give them even further discounts. You don't have to, because you already have a national price. And so you have things like insulin not, being as extortionate of a price as it is in the US. I think the US has gone too far to the private side, where I know that CMS is trying to incorporate checks and balances. There was the Inflation Reduction Act that they just brought out that is trying to curb some of the uncontrollable pricing that is going on in the pharmaceutical space, that's making it very unsustainable. But for the most part, like, manufacturers can, freely price when they enter the US market. And again, it has its pros because the US gets the most innovative drugs first. People get access to those drugs right when they launch. Insurance companies will cover it. So I think once you have that baseline, it depends on the demographics of your country. We have a very young population. We have a huge population. We have a lot of urban centers, but we do have a significant part of our population that's in the rural space. And so I think getting that baseline primary healthcare in place that covers citizens and working our way up to getting the funding and diverting some of the GDP, more than 4%, to, funding healthcare. I think over time, then you could see that the, universal package increases and you have more specialist care that is covered. Or let's say it's subsidized up to a certain percentage of the cost of care, and then you can get a private insurer to cover the rest. That kind of balances things out. But I think today, we just don't really have that. And so it's not really working. And I think a big thing is also someone has to change the way we think about health insurance as a country. I know it's easy to get caught up in the bubble of, highly educated individuals, professionals. We do see health insurance as a necessity, but there is a huge perception, a negative perception of health insurance. Your biggest competitor is Jesus or God or whoever it is, because a lot of people just do not want to think about getting health insurance. And so you almost need to shift the cultural perception to increase the demand for health insurance. And I don't know where that's going to come from. It's a lot of education campaigns, awareness campaigns, and even in the example in Kano about, these, rural areas where they had to make it more like a crowd-funded, insurance scheme to make people more comfortable. You really have to think about the culture and how that impacts what's going on in terms of the demand for healthcare services.
Yeah, that reminds me of a funny story of life insurance. Apparently, it wasn't always called life insurance. It was actually the more realistic name, more something about debt guarantee or something like that. Because technically, it's actually something that benefits after death. But you have to
Yeah.
change the name to almost like, again, back to branding. You have to change the name to kind of give people a new concept, and that's even in the Western world. So
Yeah.
I completely agree with that. If I'm being honest, one, you already have people that are already earning so very little disposable income. Then two, they'll very so believe in faith and all of that. So they really have to be taught differently about insurance, and there has to be some elements of, I don't want to say forcing, but some elements of restriction that almost makes many people are stubborn. So you almost have to also get them to the stream to drink water. Yeah.
Yeah.
So I agree with both. But what's interesting is over the years, would you say insurance is improving? Would you say it's gaining momentum? Just a real quick question on that in
And
Nigeria.
to add more color to that, right? Because we see a lot of like tech startups, right, within the healthcare space who are looking to provide in some way healthcare with this added source of healthcare insurance as well on the side, right? So that's what, so more just to add more context, do you think health insurance is now getting better with time, especially with the introduction of technology into that space now? What do you think?
I think there's a possibility that it's getting better. I know that only about 16 million people have health insurance coverage, meaning that it's still below 10% of the population that has health insurance coverage today. We only have about 68 NHIS accredited HMOs. So I do feel like if more health tech startups are providing health insurance, and the HMOs themselves, the traditional ones, the ones that have been in the industry for ages, are doing the work to kind of innovate and improve the offerings that they're giving. They're always looking for ways to expand their benefits package. I do think that that is improving, but you see that because the more people that are coming into health insurance, not necessarily means, it doesn't necessarily mean that they're getting more of the pie. It might mean that the people who are open to health insurance, they now have more options of health insurance. But you're still capped at 16 million people, right? Out of the 280 million people in the country. And so you then get to a place where there's a lot of competition with a very, very small market. And then that introduces a lot of challenges for HMOs to provide healthcare coverage effectively. And so you think about things like one of the biggest challenges for the HMOs right now is costs. Since the pandemic, the healthcare costs in the country has surged to pretty unprecedented levels. And, I know there've been interventions by the CBN and the government to kind of calm some of this down, especially because of the pandemic. But right now, the CPI for health has reached a record about 17%. And so it's driven by rising cost of pharmaceutical products and medical, dental, paramedical, hospital services. Everything is rising in cost, and you see that that is putting immense pressure on HMOs. And I think even earlier in 2022, some of these issues caused, it halted business between HMOs and providers. So the Healthcare Providers Association of Nigeria and other major provider groups, they actually announced that they would pause all operations with HMOs because with the rising cost of the, provision of healthcare services, the HMO tariffs weren't rising fast enough to meet that. But then you think about what it would take for an HMO to increase their tariffs that they're paying to their providers. They would have to go back and renegotiate contracts with all of their employer groups and all of their enrollees to increase their premiums. And when you increase your premiums, because it's like a 16 million person market that you're fighting for with other traditional HMOs, new health tech startup HMOs, all of these other offerings, you then find that when you increase new premiums, you become less competitive. So it's a very interesting space that I think is it's not as easy as you introduce more and more startups and HMOs and small, innovative apps or whatever it is. and that improves coverage beyond the 16 million people. I think it's just offering more options to really expand beyond that 16 million people. One, you need to, obviously, as I've said, you need to get more people to understand why it's important to have health insurance. Otherwise, everyone that comes into the market is now offering a very small niche part of the population even more options, and the competition is going to be intense. And you'll see people lowering their premiums. But then what happens on the flip side is that with the rising costs of healthcare, they're not able to pay providers back what they need to be paid. So it is truly I don't know. I don't think it's as simple as, more startups are coming into the country.
Problem. Yeah, it's a multi-layered issue. Yeah.
Yeah.
So where do you see tech really coming in and helping? Because I know you published a report last year on investing in health tech, and I thought it was an interesting article because you kind of shed some light on the current investment landscape and how a lot of investors invest and kind of focus on exits here and there and stuff. But where do you really see, based on your experience, where do you really see tech coming in and helping within the healthcare system efficiently, not just because they want to raise capital and exit here and there?
Yeah. I would say one of the key ones is electronic medical records. I know that space is quite saturated, but if you're able to tap into the government side of things, the public side of things, you're able to get those public clients, and at some point you're able to standardize everyone to electronic records versus paper records, or versus solely relying on paper records. I think that could unlock so much potential, because then you have the data that you need to, one, if you're a biotech and you're thinking, okay, if I develop this new drug for cardiovascular disease, how many patients would be eligible in the country? You can't estimate that unless you know how many patients in the country have cardiovascular disease. And the best way to collect that kind of information is if you have data on it. So I think that's one major industry. I think another major industry, and I've written an article about it, is the diagnostic space, just because right now, a lot of our diagnostics, you're focusing on like malaria tests, all those kinds of tests, but we need to be thinking about what more can we be doing, especially as we're facing more chronic diseases. What more can we be doing to get the information we need so that we know we're adequately funded and adequately resourced with the right medications, with the right equipment to tackle the most pressing healthcare problems. And chronic diseases are becoming increasingly, a lot of diseases are becoming increasingly hard to detect. Like if you have breast cancer, you might have breast cancer that is a specific mutation versus another mutation. That's very important because other countries have moved beyond chemotherapy. Other countries are giving you a biomarker test to assess whether you have a specific biomarker, and there's a treatment that you can get that is designed specifically to target that biomarker, that is bounds and leaps more effective than chemotherapy and less toxic than chemotherapy. So I think thinking about that, I think is very interesting, especially when you consider the fact that the African genome is the most diverse genome in the whole world. For some reason, someone's data from Ghana compared to someone's data from Sudan is completely different than what we see across other continents. I'm trying to think what other spaces. I think for now, that's where I see the most promise. I know there's a bunch of other, spaces like the medical supply chain, e-pharmacies, telemedicine. Obviously, I think anyone trying to improve health insurance coverage, even primary care coverage, that is very, very impactful. But yeah, I think that's kind of where I see, and you see a lot of this is, then you think about the fact that as a investor thinking about investing in a health tech startup in Nigeria or in Africa, you then have to think about, okay, what is your investment model? Do you want to pour a bunch of money into a company and then hope that at some point, you have a large exit or liquidation opportunity? Or are you thinking that the reality is some of these health tech companies might never offer you the huge payouts in a typical investment period, let's say 5 to 10 years, because of all the challenges that are hindering scalability that we have discussed even in the past 30 minutes. But these startups could be, an operating business. They can offer you dividends. They can have cash flow payouts over the long term. And so you have to think about, especially foreign investors, you have to think about how do you adapt your model and your expectations in the African health tech space to inform those investment decisions, and work with local founders so that you fund them sustainably and you get a sustainable business model that works. And I think that's one of the key things that anyone that's looking to invest in health tech startups on the African continent should really be cognizant of. This is not going to be your Flutter wave that's going to, pay you out in an immense big payout. There's a lot that Flutterwave didn't have to go through that health tech startups are going through, and health tech startup founders are doing the work to try and work against an infrastructure that is not conducive to providing quality care. And honestly, they're the most resilient founders that I've spoken to. A lot of them are thinking about the most innovative ways to bridge the gap of healthcare. And a lot of them are prior doctors that are, shifting because they've experienced it firsthand. They know what the biggest challenges are and they're coming up with solutions. But investors need to really think through the best model when it comes to funding these health tech startups.
Thanks for that. Thanks a lot for that, actually. Doubling down on the last thing you said, right? As far as many of the health tech startups are founded by like former doctors as well. Do you see health tech also being a substantial demand side or rather on the job market? It's a substantial supply side for job opportunities for medical students?
I definitely think so. I mean, I would love for medical students that have been trained to really go into medicine like they originally wanted to. But I do think that it is providing job opportunities, because there are just so many roles that are out there. There's so many different health tech companies. Some of them are doing emergency medicine provision. Some of them are doing primary health care. There's so many different, avenues that you can take. And not just medical students, pharmacists, nurses, midwives. There's so many health tech startups that could be even researchers, that could be a great place to start your career, or even be, a great place to kind of explore some of these options as you're pursuing your medical profession.
Yeah. And speaking of research, real quick, what's your thought on earlier you spoke about pharmaceuticals manufacturing, then that also leads to research, because the research pathway and pipeline almost produces all of this end product. And typically we saw even with Ebola, we saw with COVID, as every country was racing to find a solution, Nigeria was racing to beg, on Twitter, you get for vaccine and all of that. Do you see us, I'm trying to be realistic, I'm not going to ask you, do you see us leading in research one day, but do you see that sector, that subsector of the healthcare space growing, or what have you seen there that's caught your attention this past, decade?
Yeah, that is an interesting question. I feel like one of the most challenging things about healthcare provision in the country is that we are importing pretty much well over 90% of the drugs that we actually use into the country.
Whoa.
And because of that, the drugs are more expensive. Like, obviously you have currency and the fluctuation in foreign exchange rates, but then they get into the country and they go across a number of distributors, suppliers before they get to the pharmacy, and then the markups have gone up to 25%. So I feel like there is definitely an avenue for research on the continent. There are so many universities, not just in Nigeria, but in South Africa, all these different countries that are actually doing good work in terms of drug discovery research, in terms of actually working on drugs that could be commercializable. And if that is the case, the future, looking ahead, the future of the African continent is that we're able to provide these researchers with the funding that they need so that they can take their theses and their abstracts and their, whatever it is, it's a PhD student. And lots of these major drug discoveries in the US are someone's PhD thesis or some professor who's running a research lab, and then they discover that, there's a pathway in the metabolic system that it could cure a specific disease or something. And then they form a biotech company and then get acquired for millions and millions of dollars. And I feel like there is that space for that on the African continent because we have a lot of diseases that are endemic to our continent, something like sickle cell disease. There are global manufacturers that are creating gene therapies for sickle cell disease, but it's not that common in America. It's, African Americans or anyone of African descent, for the most part, that are their patients in those countries. But then if you could have that, localized on the African continent, someone, in some university in one of these countries develops a drug for sickle cell disease that has been tested in African patients and has been funded enough and commercialized, then you're able to give people innovative treatments, treatments that aren't fluctuating with foreign exchange rates, that could be more affordable for patients. And I do think that with the right funding, we do have the right brains on the continent. We just need to retain them, fund them, and help them see some of their innovations to the commercialization stage.
But that's well, this has been a really fun conversation. I'm over here, and I know I said I had a hard stop. I actually lost track of time. And I listened to it like,
Whoa.
yeah, oh boy, but this is great. And I know at some point we'll probably bring you back on if you're
I would love to
happy
come
with
back
that.
on.
I mean, I'm over here really enjoying this conversation. Just talks that I have to go, or that we have to cut this short. But once again, thank you for even coming on. I'm curious, what's next for actually now? Does TC stand for Temitope Coker?
It does. I'm not very
No
creative.
way.
I said TCHealth just because I was thinking, oh my God, what name can I? Because I was writing a lot of the articles I posted. They had been written 6 to 12 months before I actually started TCHealth. It was one of those things where I just was writing just out of, like a personal hobby. And one of my friends was like, why don't you just put this out there? Like, why don't you just put it out there? And so I was like, okay, you know what? I'm going to put it out there. And then I was thinking, what can I name this? Like, maybe I should think of like a Yoruba name and then twist it. But I was like, you know what? I'm a simple person. Temitope Coker, TCHealth. And that's actually what TCHealth stands for.
Smart.
I thought it was some complicated, like, damn, hidden in plain sight.
I was trying to, yeah, I mean, I was going through that, so I'm like, wait. Because I mean, I just notice I'm always trying to, like, I mean, whenever I hear a brand name, I always want to understand what's the idea behind this name. I was over here trying to crack it. TC. I went on your website, I went on your LinkedIn page. Oh wait, her name is Temitope Coker. So just this TC.
Yeah.
Okay, that's good. So what's next for TCHealth? I mean, I know you already highlighted some of the partnerships you have going on, collaborations with 54 Gene, 7RL, some of these other brands. To provide awareness. But what's next? I mean, what should we be expecting from TCHealth over the next year or 2 or 3 or 4 years?
Yeah, so more of those collaborations. We're collaborating with Wella Health, Refill. They have a PBM line, which is Refill, Pharmacy Benefit Management. And so we've been working on a series of pieces for them. 2 of them have already been published, but we have a couple more in the pipeline. Working with Lagoon Hospitals, working with Akoma Health on mental health, and Lagoon Hospitals, we're about to launch a piece on cardiovascular care in the country and some of the potential there. So there's a lot of exciting content coming this year. We are also going to launch a piece about primary healthcare. We want to do some country profiles. So looking at, obviously a lot of the work we do is Nigeria focused, but I'm very interested in other similar markets in sub-Saharan Africa. So markets like Ghana, Kenya, Uganda, Rwanda. The Ministry of Health in Rwanda is doing a lot of amazing things. So yeah, there's a lot to come. Our team is working day and night, and we're hoping to not only launch our pieces, obviously stay connected on social media, but hoping to kind of branch into other, mediums. So video interviews, things like that. So Yeah, I'm excited. A lot of work to be done, but I feel like there's a lot of educating to be done. People are hungry for information. And one of the things that I wanted to accomplish with TC Health is that when you're talking to someone about the healthcare space in Nigeria and they just say, there's nothing there. It's so bad. It's just really, there's nothing really going on there. I want to change that. I want people to say, okay, actually, I know that these are the statistics. This is the current situation. Obviously, these are the challenges, but here are the people that are actually doing something to change that. Here are some of the policies that the government is trying to push forward to change that. And here's what the future could look like. That's how I want the narrative to be for healthcare, not just in Nigeria, but in sub-Saharan Africa. So a lot of the content that we put out there is with that in mind. So I'm really excited to, come out with all this new content.
And we are excited for you as well. We're very excited for you. And we'll definitely follow up with you and just whatever way we can support, let us know. But where can people find you for those who don't know you or want to follow up with you or want to collab with you or something? Where can they find you?
Yeah, so obviously we have our website, tchealthng.com. We also have all of our social media platforms, Twitter and Instagram, TC Health NG. We're also on LinkedIn, TC Health. And you can also email us at tchealthng@gmail.com. So several ways. You can go on our website, you can fill out a form. We also have a collaboration page. So if you're interested in collaborating, there's a very quick and easy form that you can fill out, and we'll be in touch to discuss partnerships. So, and you can also, get a glimpse of some of the other partnerships that we've worked on so far.
Awesome. And
Excellent.
we'll also add all the links that Temitope just mentioned will be in the description of this podcast. So you could just use that to know to get what you want. But once again, Temitope, thank you so much for carving out some time on your weekend to talk to us. This has been an absolute pleasure. And yeah, we'll look forward to probably part 2 of this conversation because I know
Definitely part 2 for sure.
Yes,
Yeah.
we definitely need a part 2. This has been, honestly, if I could have thought of any other way to spend my Saturday afternoon, this is it. Like I could go on for, we've already gone over time. I could go on for hours. So thank you so much for thinking of me. This has been super fun, and I'm always willing to hop on the phone and do another part 2 with you guys. So
yeah. Awesome. Thank you so much.
great.
Yeah.
Thanks.